Can an IUD cause uterine perforation? Imagine choosing a highly effective method of birth control and wondering about all the possible risks. One question that often comes up is whether an intrauterine device can cause uterine perforation. The answer is yes, but it's important to understand how rare this complication actually is. Uterine perforation happens when the IUD punctures or passes through the wall of the uterus during or after insertion. While that sounds serious, the overall risk remains very low. Studies estimate that about 0.2% to 0.6% of women may experience this within 5 years after getting an IUD. The risk is higher in certain situations. For example, inserting the IUD during the postpartum period, especially between 4 days and 6 weeks after childbirth, increases the chance of perforation nearly 7 times compared to women who are not postpartum. Breastfeeding is also associated with a higher risk, roughly 6 times more than in women who are not breastfeeding. This is thought to be related to changes in the uterus caused by lactation. The experience of the healthcare provider matters too. Less experienced clinicians tend to have a slightly higher rate of perforation compared to those with more practice. Perforation can happen during the actual insertion when the device or instrument accidentally punctures the uterine wall. Sometimes, it can occur later if the IUD migrates through the uterine tissue into the abdominal cavity. Symptoms of a uterine perforation might include pelvic pain, abnormal bleeding, or feeling that the IUD strings are missing. However, some women have no symptoms at all, and the perforation is only found during routine checkups or imaging tests. Although rare, if the IUD migrates into the abdominal cavity or attaches to other organs like the bowel, it can cause serious complications that may require surgery. It's important to note that using an IUD does not increase the risk of sexually transmitted infections or other reproductive health issues. Still, because perforation is a potential risk, regular follow-up with a healthcare provider is essential. If you experience unusual pelvic pain, bleeding, or cannot feel the IUD strings, seek medical advice promptly. When considering an IUD, healthcare professionals will discuss the small but real risk of perforation, especially if you are in the postpartum period or breastfeeding. They will also emphasize the importance of professional insertion and proper follow-up care. Remember, every person's body is different, and your healthcare provider can help you weigh the benefits and risks to make the best choice for your reproductive health.